I have an annual physical with my cardiologist, Dr. Percy Aiken, and it came out really well. And during that, I asked him about having a stress test because I hadn't had one in over 10 years, and I just thought it would be a good idea to have one. And so he scheduled a stress test for me, which I had last November 9th. There were some irregularities, and he said, well, let's schedule him for a catheterization. He came into the room, talked to my wife and me, and said he couldn't do any stents, that there was too much blockage, that I had 4 arteries blocked, one almost completely, and that he didn't want to release me. He said he shouldn't even go home. The first point we could schedule him with Dr. McGinn, and so they kept me in the hospital from December 1st to December 6th when Dr. McGinn did the surgery. I had no symptoms. I work out, I'm fairly good shape since I retired, and I walk 2 miles every day. I do all my own work at home, in the yard, mow the lawn, and good diet, and presumed to be in good shape. So it caught everyone off guard. Even Dr. Aiken said he couldn't believe it.
What I do is I take a small incision on the left side of the chest, 2 to 3 inches in length, and we go in between the ribs. We don't cut any muscles, we don't cut any bones, so there's very little healing that needs to take place for the patient to get back to normal activity level. So
when they told me about this surgery where he would just make an incision here and go in between the ribs, I welcomed that, particularly for recovery time. The recovery has just been amazing. I believe I'm, according to Dr. Aiken, and I've been back to see Dr. McGinn, I'm almost, I'd say 98% back to where I was prior to the surgery.
A lot of people don't realize what we're doing. And the reality is, if they did know what we were doing, I don't think they would go for the traditional zipper incision. There really is no reason to have that done. If you look at the rest of all of the specialties in medicine, everybody's going to a smaller, minimally invasive platform. So why can't we do it in cardiac surgery? And so that's exactly what we're doing. We're actually taking patients who would typically have a traditional incision and offering them a minimally invasive approach.
I just think it's amazing that, again, that like my brother-in-law, just like I said a year ago in Philadelphia, why wasn't his doctor doing this? And I've told people about the website where they can go see Dr. McGinn do partial surgery and explain it, and it's just amazing. I'll have some of these scars, permanently, but they're so minor. It's amazing.